Despite the fact that most neurologists are residing in high-income Western countries, 80% of the burden of neurologic disorders actually resides in lower-income settings. You have a disconnect where the expertise is sitting in one part of the planet, but the disease burden is sitting in another. Attitudes in general have changed about global health. I think neurology has been a little bit later coming to the table, but we have a booming number of young, ambitious neurologists who are very global in their approach. Once neurologists arrive on the scene and start becoming engaged in care, they start being very highly sought after, because indeed neurologists can provide a great deal of care and expertise in terms of hands-on care, improving the medical education for general care providers, and also policy making.
There's really been a change in the interest in global neurology, particularly due to the pioneering work of Gretchen Birbeck, for instance. When you work in austere settings with high disease burden, a small investment can have tremendous impact.
If we can understand fundamentals about the pathophysiology of common conditions like epilepsy, neuropathies, cognitive impairment, and stroke here, those findings are important everywhere. There is this misperception in the West that malaria is behind us, and it's not. The number of malaria cases continue to be over 500,000 a year, and we estimate that about 135,000 African children each year sustain a brain injury as a result of having survived cerebral malaria. Dr. Taylor has been in Malawi working to study the pathophysiology of clinical cerebral malaria for decades. She was actually my mentor when I was a career development recipient from the NIH.
There have been many spin-offs from our work, but I think the most impactful has been our work with Gretchen Birbeck. She identified epidemiologically that there were many more epileptics in Zambia per capita than in the US. She identified control kids, and she managed to follow them forward for 5 years and showed conclusively that there is a much higher rate of epilepsy amongst the survivors of cerebral malaria than in the control patients. We've been able to contribute to the world body of knowledge on management of children with severe malaria, and we've been able to train young Malawian clinical investigators, and their careers have benefited from that experience.
I moved to Lusaka, Zambia in 2018 with my family, and we came to establish the first neurology residency program in Zambia. Prior to that time, there were no Zambian neurologists working in Zambia. It's a 5-year program. The first 3 years, our residents are fully embedded in the internal medicine residency program, and then the final 2 years are fully embedded in the neurology program. We also have a pediatric neurology program in which the residents do the first 3 years in general pediatrics and then 2 years of pediatric neurology as well. In the past 6 years, we've graduated 12 neurologists. Our graduates have started to be posted to provincial hospitals. And then also, we're really excited is that we've started to become a regional training site as well. It's really exciting for us to see that our program is improving access to neurological care nationally, but now also starting to build capacity internationally as well.
When I arrived at Chikonkata Hospital in 1994, between 70 and 80% of our adult inpatients were admitted for advanced HIV. Most of them were not going to survive the admission, and we had no treatments. It was demoralizing to have this sea of people needing help and you had very little to offer them.
Back in 2004, with a lot of commitment and support from the US government, we were able to get life-saving antiretroviral therapy.
Is transformed today, our neuro-HIV work is studying neurologic aging among people with HIV, and our patients are in their 50s and 60s. Dr. Michelle Kavalsund, I think she and I started to work together in 2001, and Michelle began studying what we thought were HIV neuropathies. And by widening the scope of her work, Dr. Kavalsund is showing that The neuropathies we're seeing in Zambia are actually mediated by other things, one of the largest being nutrition. It's been amazing to live through a period where the problem with HIV was a very full mortuary, to the problem I'm studying with HIV is how people living with HIV age.
The impact that you can have doing global neurology is enormous because the need is so great. Your expertise is going to really make the big difference. And also, I think it makes you a better neurologist.
I can't overemphasize the importance of having locally trained neurologists. My advice would be to collaborate widely, form networks, regional networks, global networks, and we in Zambia are very happy and willing to collaborate.
I think that the view of global neurology can actually be held wherever you're working. It's married closely with disparities work and with thinking about equal access to care and equal quality of care for populations.